for today's video, the task that we're going to do is to have the colostomy care as well as the irrigation. So first, for the assessment is we're going to inspect the stoma for the color, the texture, as well as the length and time and place, and then the tenderness. And then we're going to inspect the skin surrounding the stoma. And then lastly is we're going to measure the stoma first before obtaining the ostomy appliance system from the central supply. So for our planning, we're going to prepare the materials that is needed for the procedure. So for the implementation, we're going to explain the procedure to the client, and then we're going to close the curtain to provide a privacy to the client, and then we're going to perform hand washing as well as we're going to don gloves. The next step is we're going to fill in the irrigation bag with warm water. So make it sure that the irrigator valve is closed to avoid leakage. So another one is we're going to hang. So after we fill in the irrigation bag with warm water, we can hang the bag or the irrigation bag. So make it sure that your bag or the bottom of the bag is within the shoulder, linked to the patient, so that we prevent that the solution will go fast. So that we don't promote discomfort as well as abdominal cramping to the patient. So after that, after we hang the irrigation bag, we do priming. So this method prevent or remove the air into the tubing so that we cannot promote discomfort or abdominal cramping to the patient. Cut lang. So when doing the colostomy care, make it sure that the client is in side-lying position. So first, we're going to clean the stoma. We're going to remove the stool using the washcloth. We're going to remove the stool. So make it sure that you apply gently, because we're doing or avoiding irritation to the stomach or discomfort to the body. So after we remove the stool, we can dispose the washcloth. So after that, we can insert our small finger, which is our pinky finger. So before that, we're going to apply a lubricating jelly. So this lubricating jelly will prevent discomfort or as well as irritation to the patient. So we're going to insert our small finger to the stoma of the patient. So this method will be able to know. So we'll be able to know the angle of the stool as well as how the bowel is. So after we insert our finger to the stoma of the patient, we can dispose our gloves, as well as we have also perform another round of hand washing as well as we don our gloves. So after the procedure, we can apply or we can attach our irrigation sleeve to the system or 2x2 system of the patient. So after that, we can open the sleeve up. So after that, we can irrigate or we can insert the cone. We can insert the cone to the stoma of the patient for instilling the solution or the warm water. But first, make it sure that you apply a lubricating jelly to prevent discomfort as well as irritation to the client. So hypothetically, we insert the cone to the patient or the cone to the stoma of the patient. So take note that you have to insert the cone. Make it sure that you insert it slowly because we avoid irritation to the stomach of the patient. So after that, you may open the irrigation valve. You may open the irrigation valve to instill the water or the solution for about 10 to 15 minutes. So after 10 to 15 minutes, we can remove the cone for approximately 10 seconds. So after that, hypothetically, we done already for the irrigation valve. We can close the irrigation sleeve. So after we close the irrigation sleeve, let the patient have or hold the irrigation sleeve for about 30 to 45 minutes so that the irrigation fluid or the stool will come up. So this method, or we're placing the irrigation sleeve for about 30 to 45. We wait for about 30 to 45 minutes. We're going to remove the irrigation sleeve. We're going to remove the irrigation sleeve and then we're going to have a stomach care. So after that, we're going to dispose of materials that has been used to the procedure. And then lastly, for the evaluation, we're going to assess the stoma after the procedure, and then we're going to document the procedure to the as well as the findings to the patient's chart.